Hello, and welcome to today's Cuyahoga County and Board of Health media briefing. Today we are joined by County Executive Armond Budish, Board of Health Commissioner Terry Allen, Co-Director of Prevention and Wellness Ramona Brazil, and Rainbow Babies and Children's Director of Pediatric Infection Control and Innovation, Dr. Claudia Hoyen. We will begin by hearing from our county leaders and then end with some questions. With that, I will turn it over to Executive Budish.
Thank you. Good afternoon to everybody. Thanks again to Board of Health Commissioner Terry Allen and his team for joining me today and for all their great work. As we near the winter months, their expertise and recommendations will be critical in keeping us safe as we continue to weather the COVID storm. Since the beginning of the pandemic, we've been hard at work supporting residents as we all go through the ups and downs of this past year and a half. One of the ways we've done that's through protecting renters, especially those who lost a job and with that lost their income. Since last year, we've provided nearly $30 million in funding for rent and utility assistance. Many cities and counties that received federal rent relief funds have been very slow in getting the money out the door due to bureaucratic holdups. Only 14% of rent relief funds have been allocated in the state. But we were able to hit the ground running. We've distributed 81% of our funding already. Apart from COVID, there are a number of other programs available. There are a number of programs available to help renters. Some residents use Section 8 housing, public assistance, Social Security, or court-ordered payments. More than 229,000 households in Ohio use federal housing vouchers to pay their rent. Unfortunately, many renters who use what are considered these alternative means of payment face discrimination along with it. The tenant could pass every background and credit check required, yet still be denied simply based on their source of payment. Anyone with governmental or private sources of payment should be protected from discrimination when applying to rent a house or an apartment in Cuyahoga County. We have to do more to protect every resident in our county, especially for those households of color who are subject to greater discrimination. That's why I plan on submitting to County Council legislation that would protect residents from discrimination based on their source of income. This legislation would allow renters to use various sources of income to pay their rent without worrying that a landlord would deny their application because of the type of payment. Landlords would not be able to refuse to rent to someone based on their source of income or represent to a person that a dwelling is not available for inspection or rental if it actually is. If approved by council, anyone who believes they've been discriminated against because of their source of income could file a complaint with the County Human Rights Commission. The Human Rights Commission is made up of 3 commissioners who hear and decide discrimination complaints through a neutral process for both parties. This is a needed protection for our renters in Cuyahoga County. Residents should be able to choose where they want to live without having to worry if their source of payment will prevent them from being able to make that choice. To that end, we also want to give an added incentive to landlords to make equal housing a top priority. So if a landlord accepts a tenant using a Section 8 housing voucher, we'll provide funds to the landlord. This would likely cover an amount up to the tenant's security deposit and 2 months of rent. Housing vouchers help low-income families with children move to neighborhoods to promote better health and life satisfaction. This could help improve children's chances of succeeding in school and parents earning more money. Giving families more choices about where they can live creates new opportunities for residents. It's also a benefit to the landlord as they would get some short-term financial assistance. A plan like this could support housing choices for an estimated 1,400 families over a 3-year period. The impact could be significant. We still have more work to do on this, so more information will be available in the coming months. I also just want to mention that I just received my Moderna booster and my flu vaccine. And while my arm's a little sore, I'm great otherwise. So to everybody, please get vaccinated. And now I'll turn it over to Commissioner Allen.
Well, thank you, Executive Budish, and I'm glad you set the example. The sore arm will pass, but we certainly, as you know, flu and COVID are much worse, so very sound decision. Also very happy to hear about your rental assistance, particularly in the context of COVID, because we know that, safe and healthy housing and stable housing has everything to do with health trajectory, just like other basic needs like food assistance. So thank you for that. I have the pleasure now of introducing a couple people that will take us off today in our briefing on a range of issues. First, in the context of kids, we know that the FDA currently is considering the option to allow for vaccinations for 5 to 11-year-olds. And with that is a lot of context and details that emerge, and certainly parental questions. So we have two great folks with us today that will be helping to paint the picture of issues that you need to consider. We have Dr. Claudia Hoyen, who is the Director of Pediatric Infection Control and Innovation at Rainbow. And she's also an associate professor in the Department of Pediatrics at Case Western. And Dr. Hoyen, of course, is a great friend to public health and partner throughout the pandemic and years for many years prior. So we look forward to hearing from Dr. Hoyen, and she'll then be followed by our very own co-director of Prevention and Wellness, Ramona Brazil, that will talk about some of the specifics of vaccinating kids and those details that are important to consider and what parents need to know as well. So with that, I would hand things off to Dr. Hoyen.
Thank you so much, Terry and Executive Budish, for having us today. Just to let people know, as a pediatrician, I can honestly say that these last 24 hours have been very, very exciting. To have seen the group that meets prior to the FDA making a recommendation about the vaccine. That group met yesterday. And in terms of the Pfizer COVID vaccine for children between 5 and 11, they have recommended to the FDA that the Pfizer vaccine get approval. So as we know, there's a little bit of time that it'll take before hopefully we will have shots in arms. So over the next few days, we'll be waiting for the FDA to make their decision. Then the group at the CDC will meet. That's also another group of vaccine experts who will review all of the data and make their recommendation to the CDC director. And then if it gets approved at that point, then we'll be able to move to get the vaccine to one of our most vulnerable groups right now, kids between 5 and 11. So as I said, for me, it's very, very exciting to see this come about. I've been doing this for about 25 years. And cannot, really make the case to people that this has been so amazing in terms of the science that was done, the integrity of all of the studies, and the way these vaccines were able to come in the middle of this pandemic to be able to offer us relief and a way to keep each other safe. In terms of the kids, I know that, parents and even my colleagues, the physicians, have questions about these vaccines in these kids. Again, the federal government has followed the typical course for something, a vaccine that's going to cross the lifespan. They started testing it and using it in adults first. And then kind of have moved back to different age groups, knowing that different age groups respond differently to vaccines. And so that they needed to study them within those cohorts of children within the different ages to be sure that they got things right. So, as we know, the Pfizer vaccine is FDA approved for people over 16. And as we know, it's been given to hundreds of millions of people around the world, and it has really proven to be very safe and very effective. I know that in speaking to parents, there is concern of some of the side effects. The typical things that we see in terms of fever or arm pain or muscle pains. Those are all actually signs that the vaccine and your immune system are working and doing what they need to do to help you produce the immunity to protect you from the illness. In terms of other things that we've heard about in light of the mRNA vaccines, which Pfizer is one of, we know that there have been cases of myocarditis in young men. The most prominent age group was between 18 and 30. And this is a form of inflammation of the heart mostly after the second dose of the vaccine. And I can tell you, in looking at the data, those cases are much more mild than we would see if those patients actually had gotten the coronavirus itself. Because one of the symptoms that coronavirus can cause in people is trouble with their heart. And so those cases that are caused by the natural virus, as opposed to after the shot, are typically much more severe, require often ICU visits. Whereas the reaction to the shot that people have had, many of the patients, some of which we've seen at Rainbow, are typically pretty well. They may be in the hospital for a few days, and then they go home. I can tell you that as the scientists were developing the study for the younger children, they really took that into consideration. And so when they were testing the vaccines on the children in the last 6 months, they tested multiple doses. And what they found was that with the coronavirus vaccine, in the kids who are between 5 and 11, they really only need 1/3 of the amount of the vaccine to give the same effect that adults got. So that they're hoping that by doing those studies and really figuring out what is a good dose, that we won't see as many of those complications. I can tell you, I've taken care of patients with myocarditis this summer from other reasons besides COVID, and I would still recommend for any child that they get the COVID vaccine. So when we're looking at, kind of where we are right now, and what are the things that we're worried about for kids and COVID, we know that the numbers are coming down. Not as quickly as we had all hoped, but certainly within the context of the hospital and the kids that we've seen in our emergency rooms and our urgent cares, the numbers are slowly coming down. But that doesn't mean we shouldn't be vaccinating kids when we have the chance, hopefully in the next couple of weeks. Again, it's really important. And when, as a pediatrician, I weigh the risks and the benefits of vaccinating children as to, what outweighs which, it's really the benefit of the vaccine I still see is greater than any risk that there may be. Again, we know that children are not necessarily going to have as many of the terrible complications that adults have, but that is not to say that we have not seen children become very ill, require ICU care, require bypass to support them through their illness. And, within the context of kids who are between ages 5 and 11, there have been 100 children who have died in the last year and a half. And I can tell you that that is certainly far more than the number of children that have died of the flu vaccine. And the other thing that we have to keep in mind is that it isn't just acute COVID alone that we worry about with kids. One of my colleagues, Dr. Edwards at Rainbow, has started to see the children who are having the long COVID, and her clinics are quickly filling up with children who may have had even just a very mild case of COVID, but then go on for months and months to have protracted symptoms. Many children having fatigue, developing anxiety, GI symptoms. So we do worry about that. The other thing that we know we're going to start seeing within the next couple of weeks, since we just surged, is the issue of MIS-C in children, which is the multi-inflammatory syndrome of children. This is really something where your immune system after COVID kind of gets reactivated and causes much damage to other organs within your body, your GI tract, your kidneys, certainly your heart. And so, again, there are these other complications that we see in kids who have had COVID that makes us worry. I think probably one of the most striking things that I've read in the last couple weeks to really put this in context for all of us is that the CDC has reported that COVID-19 is the 8th leading cause of death in this country. And so that's really, I think, something that helps us bring this to light. This isn't something that's so infrequent. I mean, it's made the top 10, and I think that it's just important for all of us to protect our most vulnerable patients, but also everyone around us. And so that's why it's really important that we consider getting kids vaccinated, not only for their health but also for those things that Terry Allen has talked about, those other parts of life that really help with our wellness and our well being. So we know that this pandemic has been so difficult for our children. Their schedules were disrupted, they weren't with their friends, they weren't with their teachers. And so it's really critical that we do everything that we can, not only for their education, but for their mental health, to keep children in schools. And I can tell you that the vaccines are a very important part of that. I think we're starting to see some really great data and case uses within the colleges around countries where, for some of the colleges, it's actually required. And they have really not had as many issues on college campuses this year as they had last year. And so we're hoping that we'll see that very same thing within the schools, and have kids, of course, not need to get quarantined if they're exposed, not need to be isolated because they won't be sick. And so, again, really not only for the health of our children, but for their well-being and, making their futures brighter, it's important that we keep them in school and get them vaccinated so that we can accomplish that goal. The other thing that we need to be thinking about in terms of getting kids vaccinated is really just keeping them safe through the winter. One of the things that I know Terry and his group worries about, and certainly something that we worry about at Rainbow, is the potential for a twin-demic. We know that, again, the cases are going down right now, but as everyone starts to gather at the end of next month and through the month of December for all of the holidays and spending time with friends and family, we know that we will probably see another resurgence of COVID as people are coming together and spending time indoors together. So we need to worry about that in the context of the flu. So last year, we had a very quiet flu season. I think at Rainbow, we actually never admitted one child for the flu, which I can tell you in 25 years is remarkable. But that said, what we've seen over the summer, as many people have been unmasking and spending time together, is that there's been a resurgence of other respiratory viruses. RSV, for one, respiratory syncytial virus. We typically see that in November. This year, we started seeing it in August. And I was just discussing with Mr. Allen that we're still seeing it at the hospital at a pretty high rate. We've plateaued. And so, really, the last thing that hospitals, children's hospitals, adult hospitals as well need, the last thing we all need is to have cases of the flu and to surge with the flu on top of it. Not only for patients themselves, because of course, having the flu and COVID together, there's some data to suggest that your outcome is not as good as patients who've had one or the other, as well as we need to think of our frontline healthcare workers. They have been really working hard every single day. They've always worked hard, but it's been especially hard with the numbers of patients and the acuity or the amount of illness that we're seeing in patients. And of course, taking care of patients who don't necessarily survive from COVID. And so, in order to ensure that our healthcare system can remain functional, it's really important that we try to keep as many people well and out of the hospitals and ERs and clinics, so that we don't crowd out other people who have things like heart attacks and car accidents. So again, it's really a team effort, not only to keep ourselves safe, to keep our most vulnerable children safe, but also to protect the healthcare system here in Cuyahoga County, as well as across Ohio and the United States. So it would encourage everybody as we're going into the winter to not only, get their COVID shot or their COVID booster, and to get those things for their children between 5 and 11, and even those kids between 12 and 17, but also to work with your pediatrician to ensure that the children are also getting the flu shot. The really great thing that the CDC was able to kind of tease out over the summer is that it's absolutely safe, as Executive Budish told us, to get both your flu shot and your COVID shot at the same time. Typically, they'll do it in two different arms, but there is no issue with having both shots at the same time. I can tell you that at Rainbow, we are certainly working closely with all of our frontline pediatric providers to ensure that as we're going into the next week, they have vaccines and ways to not only give the COVID vaccine, but to ensure that as kids are in the office, we can get everything done that we need for them to do. And unlike the adults, and I know Ramona's going to talk a little bit more about this, really in the help that we've had from the federal government, but also the help that we've had from Governor DeWine, we are really poised to be able to safely give the COVID vaccine within doctors' offices, which, as we all know, in January and February, and even late year, that wasn't really possible due to the constraints of having to keep them very, very cold. But as things have been worked out by the companies and the FDA, the governments, like I said, have really supported us in being able to deliver the vaccine to physicians' offices. And when you think about it, that's really the best place for kids to be vaccinated. Not every child has a physician that they see regularly. And at we're planning to have some mass vaccine sites. There'll be 3 of them, one out at our MSC in Shaker, one also on the main campus at Rainbow, and also one down in Parma at Seasons of Life. But for most patients, again, it's going to be as easy as calling your doctor's office and getting an appointment to have your child vaccinated. And so, again, as I said, as a pediatric infectious disease person, doc who's been doing this for 25 years, it's really so exciting for us to see this vaccine moving down the pipeline so that we can get approval and get our children who need to be protected from this illness, but also need to have as much routine that they can have in terms of staying in school and being with their friends and seeing friends and families over the holiday. And so, just very excited to share this information with you. If you have questions, don't hesitate to reach out to your doctor or reach out to our website at Rainbow. We're always happy to take questions from people. And good luck to everyone getting an appointment for your shot. At this time, Ramona Brazil is going to go through and tell us a little bit more about how we'll be working to get kids vaccinated around the county. Ramona?
Thank you, Dr. Hoyen, for those remarks. It's always insightful and to hear from the healthcare provider, pediatrician perspective about our next steps in addressing this pandemic and keeping our children safe. So we are very excited about getting COVID vaccine approved for children. We do continue to provide vaccinations at our community-based clinics, and we are still concentrating in places with lower vaccination rates. We don't want to lose sight that if you haven't gotten vaccinated at all yet, as an either an adolescent, 12 or older, or as an adult, that you still need to get vaccinated. It's still very important that unvaccinated people start their vaccination series. You're still at much higher risk of hospitalization or death if you are unvaccinated. So we don't want to lose sight of that. We are providing booster doses of Moderna, Pfizer, and Johnson & Johnson. We also understand that there's a lot of confusion about booster doses as this information comes out, as well as switching doses. So you are still considered to be fully vaccinated after 2 weeks from receiving 2 doses of Moderna or Pfizer or 1 dose of Johnson & Johnson. There is a chance that that definition is going to change, but for right now, that is the definition of fully vaccinated. If you choose to get a booster dose, which for some people is highly recommended, especially if you're older, if you have certain medical conditions like cancer, diabetes, heart conditions, then you can switch to a different booster dose from your initial vaccine series. Now, we are not endorsing one vaccine over another. I think there may be some confusion about that. That decision about which booster dose to take is a personal decision, and it should be made with your healthcare provider. So if there's questions about which one to take, we would encourage you to talk with your healthcare provider. They know you and your health status the best. So as we have been talking about, we are preparing for the approval of COVID-19 vaccine for children ages 5 to 11. This is our largest group of unprotected people. And as a parent of a 6-year-old myself, I understand how scary it's been to navigate for almost 2 years to keep our children safe, but also provide them with a normal childhood. And vaccination is going to be a key component in getting back to what we hope to be a more normal childhood for them. We anticipate receiving children's doses early next week. As Dr. Hoyen stated, the formulation is made especially for children and is a smaller dosage than the adult dose, but through the studies have shown that a good response in providing protection for children. We do anticipate that the vaccine supply for children will be good. As Dr. Hoyen said, we don't anticipate what we saw in the spring where there is limited in limited places. This should be widely available through healthcare providers, pharmacies, and the health departments. We do encourage parents to talk with their child's healthcare provider if you have questions about the vaccine and your child's health, if there's any kind of special medical conditions that you are particularly concerned about, that you have that discussion. But as Dr. Hoyen also said, in almost every circumstance, vaccination is still going to be the best option and where the benefits exceed the risks in taking the vaccine. We do encourage families to seek vaccination through their primary healthcare provider if possible. It is probably the safest environment to vaccinate children. But at the health department, we will be preparing to provide vaccination to children as well. So we are in the process of planning clinics that will be intended for children only, in November and also in December, as well as looking at ways to safely vaccinate children in community locations where there may be less access. If you are looking for a vaccine, no matter if it's your first dose, your second dose, your booster dose, or when the children's doses become available, call your healthcare provider, or you can go to the gettheshot.coronavirus.ohio.gov website to find clinics close to you, and in some cases, make an appointment right from the website. Now we'll turn it over to Commissioner Allen. Thank you.
Thank you, Ramona. I think I'll roll into a number of updates. I appreciate the information from Dr. Hoyen and from Director Brazil, painting the picture for the importance of vaccinating kids and the considerations that parents should have. The best way to protect kids in schools and to help us move past this pandemic is to get as many people vaccinated as possible. That's our way out, and kids are the next front. And we're really excited about what may be coming forward in the next few weeks to protect more kids. So since Executive Budish mentioned the flu shot, we'll talk a little bit about flu to start off, and as did Dr. Hoyen. So our flu surveillance program for the 21-22 season is now underway. Flu activity currently is low, and you can view our comprehensive weekly reports on our website at ccbh.net. If you choose F under our A to Z index and then click on Flu Weekly Surveillance Reports, you can get those reports. As you'll recall, last year, it was very, very quiet flu season with widespread masking and social distancing and travel restrictions that substantially reduced risk across the country. This flu season, many COVID-19 restrictions have eased and businesses have reduced remote work arrangements. Consequently, this flu season is very unpredictable. The flu vaccine can prevent complications such as pneumonia and ultimately save lives, just as the COVID vaccines do. The best way, as Dr. Hoyen noted, to prevent that twindemic, having both flu and COVID-19 circulating at high levels, is, of course, to get vaccinated for both. So in transitioning to COVID-19, Cuyahoga County remains at over 3 times the CDC threshold for high transmission. Now, that's lower than 2 weeks ago when we were at 4 times high transmission, 4 times the CDC rate. But all 88 counties in Ohio still remain at high transmission. We have seen, as Dr. Hoyen noted, some encouraging downward trends in cases, and modeling conducted by Case Western and the University of Akron indicate that cases should continue to decrease into November. And so that's an exciting possibility. This is welcome news, and if we all mask indoors and get vaccinated, we can speed our recovery as we all look ahead to the holidays. Unfortunately, we know that our area hospitals have been experiencing high utilization. We're glad to hear that there's less volume with our pediatric patients from Dr. Hoyen's perspective on what's happening there at Rainbow. But we do know that overall critical care beds in the community for adults are at 80% of the capacity used to treat all patients who may come in for any illness. Hospitals have been triaging patients based on the level of need and delaying certain procedures, in addition to reducing visitation in an effort to continue to slow this surge. Staffing shortages have further exacerbated the situation on the ground in many hospital systems. And getting both that COVID and flu vaccine will also help not only to protect you and your family, but to protect our hospital capacity to care for everybody who needs help. We'll remind everyone that the indoor masking advisory, which we issued on September 15th, remains in place. And it's been particularly important in the school setting where cases among students and faculty have been high. Cases in the school environment require isolation and quarantine of students and staff to reduce risk. And it, of course, interrupts in-person education we know that every child needs. And the data is clear. If everyone's masking and distancing in those school environments, the need for quarantine is substantially reduced and kids get to stay in school and learn. We join our children's hospitals in continuing to urge schools to adopt universal indoor masking requirements to protect children and families to keep them safe. On Monday, the Ohio Department of Health revised its quarantine guidance for schools. And the new guidance is called Mask to Stay and Test to Play. For Mask to Stay, direct close contacts, regardless of vaccination or masking status, may remain in the classroom environment if they do the following. They wear a mask for 14 days after their last date of exposure. They then also need to self-monitor, or the parent should monitor for symptoms of COVID-19. If they have symptoms, they need to isolate and get tested if they start to experience them. And regardless of the severity of those symptoms, they should isolate. Consistent with the guidance for other quarantining and low-risk environments, students and staff may discontinue these quarantine procedures after 7 days if they don't develop symptoms and test negative between days 5 and 7 after exposure to a COVID positive person. Direct contacts for COVID-19 are those individuals who are identified as being directly exposed to COVID-19 by the positive case. Remember, COVID-19 is a respiratory virus and doesn't require physical contact to spread. It spreads through sneezing, coughing, talking, or breathing. Consequently, the best practice for distancing is 3 feet with everyone masked and 6 feet, if not masked, in the school environment. Parents and students are responsible for symptom monitoring. However, if nurses or school staff see a child exhibiting symptoms, they should act accordingly and the child should isolate at home. For Test to Play, asymptomatic contacts may continue to participate in extracurricular activities if they do the following. They wear a mask when they're able, and this includes during transportation to events, in locker rooms, sitting or standing on sidelines, and any time the mask will not interfere with breathing, the activity, or create a hazard. They should also test on an initial notification of an exposure to COVID-19, and then test again, as noted, on days 5 to 7. And if they're negative at that time, then they can test out of quarantine. These tests are all PCR or antigen tests for SARS-CoV-2. Then they should be observed. These tests should be observed by someone and cannot be an over-the-counter at-home test that was self-administered without a proctor. So they need to be observed. Districts should consider same-day testing for athletic competition where there's a potential also for school-to-school exposure. This reduces that risk. So we should always remember, if we want our schools and workplaces open and to prevent more of our residents from getting COVID-19 and ultimately bring an end to the pandemic, we must meet this imperative to vaccinate more people now. And when the vaccine is available for children, to vaccinate as many children as possible that are eligible, and embrace the masking when around others in indoor environments. If you're unmasked and unvaccinated and around others, your risk for contracting COVID is going to be very high and remain so in the coming months. On the vaccination front, about 56% of all of our residents have been fully vaccinated. In terms of vaccine equity, about 35% of the African American population and 47% of our Hispanic Latinx population are vaccinated. And so we know that many of us remain unvaccinated and vulnerable to contracting and spreading the Delta variant. So as Director Brazil noted, we encourage all adults to get vaccinated, everybody over age 12 to get vaccinated. And lots of places, pharmacies, health departments, hospital settings, and community health centers. And we now have been offering $100 cash cards for those who visit one of our clinics for a first dose. And so these cards are only for the first dose and not for second or boosters. And the locations and dates and times of our clinic are available on our website. If you go to the top and choose COVID-19 information from the drop-down menu, you'll find the clinic schedule, and our first dose clinics are listed as community clinics. And again, you've heard the gettheshot.coronavirus.ohio.gov or call 211 to schedule an appointment. As we've discussed in previous briefings, people with immune systems that are compromised moderately or severely are eligible for an additional dose of COVID-19 vaccine. And this is now, as Director Brazil noted, for Pfizer, Moderna, and J&J. and they're available for eligible recipients. And you're eligible for Pfizer and Moderna if you receive the second dose if you've received your second dose at least 6 months prior to the date of the booster clinic. And for Pfizer and Moderna, if you're 65 years old or 65 years or older or live in a long-term care setting, you're eligible. And people ages 50 to 64 with certain underlying health conditions should receive a booster shot. Always check with your doctor on your risk. And people age 18 to 49 with certain underlying medical conditions may receive a booster. And also people over age 18 who are at risk for COVID exposure and transmission because of their job or living in an institutional setting may receive a booster as well. You're eligible for Johnson & Johnson booster if you received your dose of J&J at least 2 months prior to the date of the booster clinic. And we have, as Ramona noted, we're holding booster clinics in the community, have been and will continue to do so. Many places to get that booster at gettheshot.coronavirus.ohio.gov. And remember, wherever you get your shot, your booster shot, bring that vaccination card with you. Bring it with you. We need to have that present in order to provide you that dose. We heard a very, very important message this week from the Ohio Department of Health Director, Dr. Vanderhoff. He said that all the children hospitalized with COVID-19 in Ohio have not been vaccinated, every one of them. So every child hospitalized for COVID-19 currently in Ohio has not been vaccinated. So our opportunity now to protect our kids is to get them vaccinated when the opportunity arises. And we'll be tracking the national discussions and then the subsequent guidance from the Ohio Department of Health to make determinations on beginning vaccination for kids. On the testing front, if you're experiencing symptoms, we're seeing, of course, an increase in volume and have seen an increased volume in testing with the Delta variant. People are out seeking testing in lots of places. We're at 9.4% of residents tested as positive, and that's just slightly up from 9.3% 2 weeks ago. So we advise parents, students, school faculty, and administrators to go to the retail pharmacies to get tested, especially for asymptomatic exposed students and patients. And area libraries have been receiving kits from the state, so remember the libraries have rapid antigen tests. Hospitals have requested that if you're symptomatic and stable or need a confirmatory test, that you should go to an outpatient care center or a primary care setting. And please, please don't go to the emergency department for a test. We need to keep the emergency rooms open for those that are most in need. With that, we appreciate you tuning in, and I'll turn things back over to Devin. Thank you.
Thank you all for your remarks. We now have a few minutes for some questions. Please state your name and media organization when asking a question, and remember to stay muted when not speaking. Also, just a friendly reminder, if you are watching on YouTube as well, you'll need to turn off the sound on YouTube when asking a question to avoid any audio feedback. Thank you very much. And with that, do you have any questions?
Hi, this is Anna with IdeaStream. I just have a quick question about the timeline of getting the vaccines to that younger age group. So I just am checking to see, people keep saying the next couple of days. So is this expecting to ship in the next couple of days and be ready, already at the health departments and hospitals when the CDC gives the final green light? Or could it be next weekend? Or I guess just some more specifics, because I know people are curious if they can start scheduling soon.
At Rainbow, we are expecting our shipments either later this week or very early next week from the state of Ohio, so that, as the FDA hopefully makes it available. And then, as we said, it still needs on Tuesday to go through the CDC process because they're the ones who actually make the recommendation for people to get it. The FDA will clear it, that it's okay to give, and then the CDC needs to give their final say. So probably sometime Wednesday or Thursday next week, if things follow accordingly, we'll have that approval from the Centers for Disease Control. And as I said, our pediatric practices and our vaccine clinics are expecting those vials of doses that are specific to this age group to be arriving sometime later this week or early next week. Does that help?
Yeah, definitely. I guess I'm just, so expecting the vials themselves later this week. And that all depends on the FDA's emergency use authorization too, correct?
Yeah, I think once the EUA is approved, the emergency use authorization, then they'll begin shipping them out. And then, of course, we can't give them until we have the approval from the Centers for Disease Control, which they are meeting, I believe, Tuesday and Wednesday of next week. So, I know at UH we have everything ready to go, just ready to open up the channels for getting people scheduled and into the offices when we have the green light. Was there anything I missed, Terry?
Got it.
All good, Dr. Hoyen.
Thank you.
Any other questions? All right. Well, thank you very much for joining us today. That concludes this week's briefing. Thank you very much, and we will see you in a few weeks. Have a great day.
Stay safe.